Hi, my name's Kara Novak. I'm one of the certified nurse midwives with the Women's Health Clinic within Peak Vista here in Colorado Springs. I'm here today to talk to you about your birth plan, what to expect when you arrive at the hospital, where you will deliver, and other things to expect during your labor and delivery and your stay at the hospital. First off, we do our deliveries at Memorial North. If you click the link below, that will be a tour that you can see online. Due to current COVID restrictions, we are not allowed to do in-person tours, but this will give you an idea of what to expect when you arrive at the hospital. First off, I'd like to talk to you about a birth plan and your birth preference. The birth plan is a set of instructions you make about your baby's birth. It might include things like where you want to have your baby, who you want to be with you during your labor and delivery, if you want medicine to help with labor pain, if there are cultural traditions you'd like to follow during labor and birth, and if you plan to breastfeed. Peak Vista delivers at UC Health Memorial North Campus, which is the tour that you will see earlier in the slides, where your certified nurse midwife or doctor will be for your delivery. The certified nurse midwives are available 24 hours a day, Monday, Wednesday, Thursday, and Friday. The days a certified nurse midwife are not at the hospital, a doctor will be there for delivery, so on Tuesdays, Saturday, Sunday. A doctor is available anytime during your stay for any emergency situations that may arise, or in the event a C-section is necessary. When you go to the hospital, your nurse will do an admission checklist where they ask you a bunch of questions. Some of these include, are you wanting baby to get medications after birth? These include vitamin K, erythromycin ointment, and hepatitis B vaccine. Who is going to cut baby's umbilical cord? Are you breast or bottle feeding? Are you planning to get an epidural or IV pain medication during your labor? Those are just a few of the questions. Worth the wait. Why wait till 40 weeks? Your baby needs 40 weeks in the womb because important organs like your baby's brain, lungs, and liver need time to develop. He's less likely to have health problems after birth, like breathing, vision, and hearing problems. He can gain more weight in the womb. He can suck and swallow and stay awake long enough to eat after he's born. He's less likely to have learning problems and health problems later in life than babies born before 40 weeks. Important organs like your baby's brain, lungs, and liver need time to develop. The brain develops fastest at the end of pregnancy. A baby's brain at 35 weeks of pregnancy weighs only 2/3 of what it will weigh at 39 to 40 weeks. He's less likely to have health problems after birth, like breathing, vision, and hearing problems. He can gain more weight in the womb. Babies born at a healthy weight have an easier time staying warm than babies born too small. He can suck and swallow long enough to stay awake enough to eat after he's born. Babies born early sometimes can't do these things. He's less likely to have learning problems and health problems later in life than babies born before 39 weeks. Babies born also have an increased risk of needing to be transferred to the NICU or nursery for further evaluation and potential admission for an undetermined amount of time. Packing your hospital bag. These are just some ideas of what you would like to pack. Lip balm, your own toiletries such as shampoo, conditioner, body wash, slippers, glasses, a nursing bra, nursing pads, phone chargers, snacks, bathrobe and comfortable clothes, your own pillow, lanolin, the hospital does provide that so you don't have to bring that in, pads, underwear, and diapers. The hospital also provides these, but some people like to use their own items. Going home clothes for you and the baby, car seat, and any other items that you think you would like to have present. Bring what makes you most comfortable and what would make you feel at home. The hospital will provide you and your significant other blankets and pillows, even shampoo, body wash, toothbrush, and toothpaste. But if you have specific things you like to use that would make you feel more comfortable and relaxed during your labor experience, bring those. The hospital will also provide diapers, wipes, and a pacifier if needed, lanolin cream as well as other items after birth, such as pads, panties, ice packs, Tux pads, Dermaplast spray, which helps with discomfort after delivery. If you have particular items you like, bring those, but nothing is required. COVID-19, their ever-changing protocols. If you have a set induction date, a scheduled C-section, your provider will write a prescription to get a COVID screening test completed before your induction or cesarean scheduled date. If you do not get COVID screening before your admission, screening will be completed at the hospital. Policies are ever changing at this time with COVID. You may ask your provider closer to time you are due about what the current policies are in the hospital. For example, bringing visitors. How many are masks worn on mom during the entire labor? Other questions if you have them. Labor. What is labor? What are the signs of labor? If you have strong and regular contractions, you feel pain in your belly and lower back, you have a bloody, brownish or reddish mucousy discharge, or your water breaks. Labor, also called childbirth, is the process of your baby leaving the uterus. You're in labor when you have regular contractions that cause your cervix to change. Contractions are when the muscles of your uterus get tight and then relax. Contractions help push your baby out of your uterus. Your cervix is the opening to the uterus that sits at the top of the vagina. When labor starts, your cervix dilates or opens up. As you get closer to your due date, learning the signs of labor can help you feel ready for labor and birth. If you have signs of labor, call your healthcare provider. You know you're in labor when you have strong and regular contractions. A contraction is when the muscle of your uterus tightens up like a fist and then relaxes. Contractions help push your baby out, and when you're in true labor, your contractions last 30 to 70 seconds and come about every 3 to 5 minutes. They're so strong that you can't walk or talk during them. They get stronger and closer together over time. You may feel pain in your belly and or your lower back. The pain doesn't go away when you move. Try comfort measures like changing positions or warm bath or shower. You may have a bloody, brownish, or reddish mucus discharge. This is called bloody show. Your water breaks. This does not need to happen for you to be in labor. Your baby has been growing in amniotic fluid, the bag of water, in your uterus. When the bag of water breaks, you may feel a big rush of water or you may feel just a little trickle. If you think you're in labor, call your healthcare provider, no matter what time of day or night. Your provider can tell you if it's time to head to the hospital to see for sure that you're in labor. Your healthcare provider measures your cervix. What are the signs that you may be close to starting labor? You may be close to starting labor if your baby drops or moves lower into your pelvis. This is called lightning. It means your baby is getting ready to move in position for birth. It can happen a few weeks or even just a few hours before your labor begins. You have an increase in vaginal discharge that's clear pink, or slightly bloody. This is called show or bloody show. It can happen a few days before labor starts or at the beginning of labor. At a prenatal checkup, your healthcare provider may check your cervix and tells you that your cervix has begun to efface or thin and dilate or open. Before labor, your cervix is about 3.5 to 4 centimeters long. When it's fully dilated or open for labor, it's 10 centimeters. Once labor starts, your contractions help open your cervix. You have the nesting instinct. This is when you want to get things organized in your home to get ready for your baby. You may want to do things like cook meals or get the baby's clothes and room ready. Doing these things is fine as long as you're careful not to overdo it. You need your energy for labor and birth. If you have any of these signs, you may start labor soon. Learn the signs of labor so you know when to call your provider. And then there is preterm labor. Preterm labor is what happens before 37 weeks of pregnancy. Babies born this early can have lifelong or life-threatening health problems. Change in your vaginal discharge, watery, mucousy, or bloody, or more vaginal discharge than usual. Pressure in your pelvis or lower belly like your baby is pushing down. Constant low, dull backache. Belly cramps with or without diarrhea. Regular or frequent contractions that make your belly tighten like a fist. Their contractions may or may not be painful, or your water breaks. The birth. Most women have their babies by vaginal birth, but some women have a cesarean section. Sometimes a labor induction may also be done. What is inducing labor? Inducing labor, also called labor induction, is when your healthcare provider gives you medicine or starts other methods like breaking your water, amniotic sac, to make sure your labor starts. The amniotic sac, also called the bag of water, is a sac inside the uterus that holds your growing baby. The sac is filled with amniotic fluid. Contractions are when the muscles of your uterus get tight and then relax. Contractions help your cervix to dilate and eventually push your baby out of your uterus. Your provider may recommend inducing labor if your health or your baby's health is at risk or if you're past your due date, typically by 1 week. For some women, inducing labor is the best way to keep mom and baby healthy. If there are medical reasons to schedule an induction, talk to your provider about waiting until at least 39 weeks of pregnancy. This gives your baby the time she or he needs to grow and develop before birth. Inducing labor should be for medical reasons only. How is labor induced? Your healthcare provider uses one or more of the following methods to induce your labor. Separating the amniotic sac from the wall of the uterus, also called stripping or sweeping the membranes. This is only an option if your cervix is at least 1 centimeter dilated. Your provider gently puts a gloved finger through your cervix and separates the amniotic sac from your uterus. The cervix is the opening to the uterus that sits at the top of the vagina. You can have this procedure done in your provider's office. You may have some cramping or spotting after. Ripening the cervix. Your provider gives you medicine called prostaglandins to help soften and then thin your cervix so it will open during labor. You may get the medicine by mouth, or it may be put in your vagina and is only given when you're admitted to the hospital. Or your provider may use an instrument called a Foley bulb, which is a thin tube with a balloon at the end that is inserted into the vagina to help dilate the cervix. Typically, the Foley bulb is used at the same time as Pitocin or prostaglandins. Giving you medicine to start contractions. Providers often use a medicine called Pitocin to induce labor. The medicine is the man-made form of a hormone that is already present in your body that helps start contractions. At the hospital, your provider gives you oxytocin through an IV, which is a needle into a vein. It may make you have really strong contractions. Ask your provider about pain medicine you may want to have during labor. Breaking your water, also called rupturing the membranes. Your provider uses a small hook that looks like a knitting needle to break the amniotic sac that holds your baby. This shouldn't be painful, but you may feel a warm gush of fluid. Inducing labor can take a few hours or a few days. It depends on how your body responds to your treatment. What is a C-section? A C-section, short for cesarean birth, is surgery in which your baby is born through a cut in your abdomen and into the uterus, done by the doctor. Most babies are born through vaginal birth, but if there are problems with your pregnancy or with your baby's health, or you've had a previous C-section, you may need to have your baby born in this method. A C-section may be planned, also called scheduled. This means you and your healthcare provider decide when to schedule the C-section based on your health and the health of your baby. Most C-sections are scheduled at 39 weeks, but can be done sooner based on medical need. Or a C-section may be an emergency C-section. This is when you need a C-section immediately because your health or your baby's health is in danger. A C-section should be for medical reasons only. What are the stages of labor? Labor, pushing, and birth, and delivery of the placenta. Every woman's labor is different, and your labor may be different each time you have a baby. But there are patterns to labor that are true for most women. What happens in the second stage of labor? In the second stage of labor, your cervix is fully dilated and ready for childbirth. This stage is the most work for you because your provider wants you to start pushing your baby out. This stage can be as short as 20 minutes or as long as a few hours. It may be longer for first-time moms or if you've had an epidural. An epidural is pain medicine you get through a tube in your lower back that helps numb your lower body during labor. It's the most common kind of pain relief used during labor. The second stage of labor ends when your baby is born. During the second stage of labor, your contractions may slow down to come every 2 to 5 minutes apart, but they last 60 to 90 seconds. You may get an episiotomy. This is a small cut made at the opening of the vagina to help the baby out. Most women don't need an episiotomy, and this is not common practice. Your baby's head begins to show. This is called crowning. Your provider guides your baby out of the birth canal. In certain situations, the doctor may use special tools like forceps or vacuum to help your baby out. Your baby is born and the umbilical cord is cut. Instructions about who's cutting the umbilical cord are in your birth plan. What you can do. Find a position that is comfortable for you. You can squat, sit, kneel, or lie back. Certain positions are only options if you have not had any pain medication. Push during contractions and rest between them. Push when you feel the urge or when your provider tells you. If you're uncomfortable or pushing has stopped, try a new position. What happens in the third stage of labor? In the third stage of labor, the placenta is delivered. The placenta grows in your uterus and supplies your baby with food and oxygen through the umbilical cord. The stage is the shortest and usually doesn't take more than 30 minutes. During the third stage of labor, you have contractions that are closer together but not as painful as earlier. These contractions help the placenta separate from the uterus and move into the birth canal and begin after you've delivered your baby. You continue to have contractions even after the placenta is delivered. You may get medicine to help with these contractions and to prevent heavy bleeding. Your provider squeezes and presses on your belly to make sure your uterus feels tight. If you've had an episiotomy, your provider repairs it now. If you're storing your umbilical cord blood, your provider collects it now. Umbilical cord blood is blood left in the umbilical cord and placenta after your baby is born and the cord is cut. Some moms and families want to store or donate umbilical cord blood so it can be used later to treat certain diseases like cancer. Your instructions about umbilical cord blood can be part of your birth plan. You may have chills or feel shaky. Tell your provider if these are making you uncomfortable. What you can do. Enjoy the first few moments as a new mom. Start breastfeeding. Most women can start breastfeeding within 1 hour of their baby's birth. Give yourself a big pat on the back for all your hard work. You've made it through childbirth. When can you hold your baby? As soon as your providers make sure your baby is healthy, you can hold her. Holding your baby skin to skin, also called kangaroo care, keeps your baby warm and helps your baby get ready for breastfeeding. This is also a special moment to bond with your baby. If you had a vaginal birth, your provider places your baby skin to skin on your bare chest or belly and covers you both with a warm blanket. If you've had a C-section and were awake during the operation, you may be able to hold your baby skin to skin right away. After a C-section, some babies need to spend time in the nursery. Your baby may spend a few hours in an incubator. This is a clear plastic bed that keeps your baby warm. If you had general anesthesia for your C-section, you may not wake for a few hours after the operation. When you wake up and feel well enough, you can hold and breastfeed your baby. What to expect after delivery. Typically, mom and baby will recover in the labor room for 2 hours, and then you will both move to the postpartum floor where you will stay until you go home. Moms, your nurse will be rubbing on your stomach every so often after delivery until you go home, most frequent the first 2 hours after delivering, to help keep you from having too much bleeding. They push on the top of your uterus called the fundus to make sure the uterus stays hard like a grapefruit. If your uterus isn't staying hard, it can cause more bleeding. It can be uncomfortable, but this is something to do to ensure you have a safe and healthy outcome. If you have a vaginal delivery, you and your nurse will get you up to the bathroom just before going down to the postpartum floor, and your nurse will show you how to use peri-care supplies. Newborn care in the delivery room. The first hour after birth is called the golden hour. This is where we prefer the baby stay skin to skin on the mom. There are many benefits to skin the first hour of life, and a few of these include help regulate baby's body temperature, blood sugar, and even bonding with mom. All newborn assessments done by the baby's nurse will be performed with mom holding the baby skin to skin when at all possible. In some instances, baby may need to go to the warmer after birth before doing skin to skin if it needs closer monitoring, interventions, and then may be transferred to the nursery at or NICU at Children's. All births are different, but there will be a full team there to help you bring your baby into this world and ensure healthy outcomes for you and your baby. During the second hour is when the baby nurse will weigh and do medications on the baby before you get moved to your postpartum room. The APGAR score. The provider grades each category with a score of 0, 1, or 2. He then adds the numbers for the final APGAR score. Most babies have an APGAR score of more than 7, which means they're in good condition. Babies with low APGAR scores may need extra attention or special medical care in the newborn intensive care unit, or the NICU. This is the nursery in a hospital where newborns get medical care. Babies with low APGAR scores may need oxygen or medicine to make their heartbeat stronger if they have problems with their heart or lungs. Premature babies sometimes have a low APGAR score because they may not be fully developed. Some babies have a low APGAR score because of a difficult labor. Newborn screenings. Some of the things that will happen to your baby after delivery include: measure your baby and take his temperature. Your baby's provider checks your baby's weight, length, and size of his head to ensure that he is at a healthy range for his age. The baby also gets their temperature taken. Give your baby a vitamin K shot. For a few days after birth, newborns can't make their own vitamin K, which is needed to help their blood clot. The vitamin K shot protects your baby from developing a rare, serious bleeding problem called hemorrhagic disease of the newborn. Giving your baby a hepatitis B vaccine. The hepatitis B vaccine protects your baby against hepatitis B virus, also called HBV, which can cause liver problems. Most babies get this vaccine within 24 hours after birth. Treat your baby with eye drops. Your baby gets antibiotic eye drops or ointment. This protects his eyes from infections that a baby can get during vaginal birth. Your baby doesn't need the eye drops right away, so you can ask that they get them later. Give your baby medical bracelets and take footprints. Babies usually get 2 identity bracelets, one on his ankle, the other on his wrist. One of these bracelets matches mom and dad, and the other is a security device. Your baby's footprints are part of your baby's first medical record. Why do babies get newborn screening tests? Before your baby leaves the hospital, she has some special tests called newborn screening. Newborn screening checks for serious but rare conditions that your baby has at birth. It includes blood screening, hearing screening, and heart screening. Safe sleep for your baby. Safe sleep means putting your baby to sleep in ways that can help protect him from dangers like choking and suffocation or not being able to breathe, and sudden infant death syndrome, also called SIDS. SIDS is the unexplained death of a baby younger than 1 year old. SIDS usually happens when a baby is sleeping. It's sometimes called crib death because a baby often passes away in the crib. Newborns sleep about 16 hours a day, usually in 3 to 4 hour periods. Your baby needs to eat every few hours, which is why he doesn't sleep for longer periods of time. Your baby may get cranky or overtired if she doesn't get enough sleep. Don't be surprised if your baby can only stay awake for an hour or 2. Over time, her body gets into a sleep pattern. She starts sleeping for longer stretches, even during the night. If you're worried about your baby's sleep, talk to her healthcare provider. The safest place for your baby to sleep is by herself in a bassinet or a crib. If you have multiples, twins, triplets, or more, put each baby in his or her own bassinet or crib. Put your baby to sleep on his back every time until he's 1 year old. It's not safe for a baby to sleep on his side or tummy. If your baby can roll from his back to his side or tummy and back again, it's okay if he changes positions while sleeping. Dress your baby in light sleep clothes. Remove any strings or ties from his pajamas and don't cover his head. A blanket sleeper can help your baby be warm without covering his head or face. It's safe to swaddle your baby for sleep until he can roll over onto his tummy. But once he can roll over, stop swaddling. A swaddling baby who is placed on or rolls onto his tummy while sleeping may be more likely to develop SIDS and pass away. Swaddling is when you snugly wrap a light blanket around your baby so that it covers most of his body below the neck. Give your baby a pacifier. Pacifiers may help protect against SIDS. If you're breastfeeding, wait until your baby is 3 to 4 weeks old or until she's used to breastfeeding before giving her a pacifier. If your baby won't take a pacifier, don't force it. It's okay if the pacifier falls out of your baby's mouth during sleep. Don't hang the pacifier around your baby's neck or attach the pacifier to baby's clothing or stuffed animal. Give your baby a pacifier for naps and at bedtime. Breastfeeding for at least the first 6 months of your baby's life can reduce your baby's risk of SIDS. Do's and don'ts for safe sleep. Do put your baby to sleep on his back on a flat, firm surface. Do put your baby in bed with his own crib or bassinet. Do make sure your baby's bassinet, crib, or play yard meets current safety standard measures. Do remove hanging window cords or electrical wires near when your baby sleeps. Do keep the room at a comfortable temperature. Don't use sleep positioners. Don't let your baby sleep in a carrier, sling, or car seat or stroller. Don't put your baby to sleep on soft surfaces like a waterbed, sofa, soft mattress, or cushion. Don't keep crib bumpers, loose bedding, toys, or other objects in the baby's bed. And don't use cribs without drop side rails. Well baby checkups. Most babies get checkups at the following listed times during their life. The pediatrician will schedule these appointments for you accordingly and when most appropriate. Some babies get well baby checkups in between these time frames, just according to what the pediatrician's recommendation is. What happens at well baby visits? At your baby's checkups, your baby's provider charts your baby's growth. This means the provider weighs your baby and measures her length and the size of her head. The provider puts this information on a chart so you can see how much your baby is growing between visits. You can also see how your baby's growth compares to other babies at the same age. Gives your baby a physical exam. The provider checks your baby from head to toe to make sure he or she is healthy. If there are any problems, the provider can give your baby tests or treatments. The provider may also refer you to a healthcare provider who specializes in treating babies with certain medical conditions if these come up. Your baby's provider checks your baby's development. Your baby's provider checks to make sure your baby is meeting developmental milestones. These are skills and activities that most children can do at a certain age. Milestones include rolling over, picking things up, and eventually walking and talking. The provider also talks to you about your baby's nutrition. Your provider talks to you about what, how much, and how often you feed your baby. If you're breastfeeding, this is a great time to tell your provider if you're having trouble feeding your baby or if you're worried about how much she's eating. As your baby grows, talk to the provider about when to start solid foods and what foods are best for your baby to eat. Your baby's provider can also give the baby vaccinations. A vaccination is a shot that contains a vaccine that helps protect your baby against certain diseases. A vaccine is medicine that makes your baby immune to certain diseases. If your baby is immune to a disease, he hopefully cannot ever develop that disease later in life. And the baby's provider also talks to you about general baby care. You and your baby's provider can talk about what to expect as your baby grows. Ask any questions you have. Write them down so you don't forget them. You can talk about things like car seats and how to make your home safe for your baby. Your baby's provider will ask how you and your family are caring for your baby and if you're feeling stressed or overwhelmed. It's okay to tell your baby's provider how you feel, especially if you have signs or symptoms of postpartum depression. This is a serious medical condition that can make it hard for you to care for yourself and your baby. Don't be afraid to tell your provider's baby. Don't be afraid to tell your baby's provider or your provider if you're feeling run down, stressed, or depressed. Postpartum care. After you deliver your baby, you will be seen in the clinic by your provider between 1 to 2 weeks for the first appointment and 6 weeks for the second appointment. Sometimes, based on your transition after your baby is born, your provider will schedule you in between these 2 appointments. All of our patients are seen by behavioral health to ensure a healthy and happy postpartum period. If you feel sad or moody in the first few days after having your baby, you may have the baby blues. Lots of women feel this way. Baby blues usually go away by themselves within a week or 2 of giving birth. You don't need medical treatment for baby blues. If your sad feelings last longer than 2 weeks, tell your healthcare provider. What do the baby blues feel like? You feel sad and cry a lot. You feel moody or cranky. You have trouble sleeping, eating, or making decisions. Feel overwhelmed and that you can't do a good job of taking care of your baby. If you feel scared or out of control, tell your provider. If you're worried about hurting yourself or your baby, call 911. What you can do about the baby blues. The baby blues usually go away on their own without treatment, but here's what you can do to help you feel better sooner. Get as much sleep as you can. Ask for help from your partner, family, and friends. Tell them exactly what they can do for you. Try to connect with other new moms. Ask your provider to help you find a support group. This is a group of people who have the same kinds of concerns. They meet together to try to help each other. Don't drink alcohol, use street drugs, or abuse prescription drugs. All of these can affect your mood and make you feel worse, and they can make it hard for you to take care of your baby. Postpartum depression is not your fault. It's a medical condition that needs treatment, but it does get better. Many women have postpartum depression after having a baby. It's the most common problem for a new mom. If you think you have postpartum depression, tell your provider. Postpartum depression can make it hard for you to take care of yourself and your baby. If you have signs or symptoms of postpartum depression, talk to your provider about treatment. Certain kinds of counseling can help depression. If you're at risk for depression, talk to your provider about finding a counselor. Changes in your feelings. Feelings depressed most of the day, every day. Feeling shame, guilt, or like a failure. Feeling panicked or scared a lot of the time, or having severe mood swings. Changes in your everyday life. Having little interest in things you normally like to do. Feeling tired all of the time. Eating more or less than is normal for you, gaining or losing weight, having trouble sleeping or sleeping too much, having trouble concentrating or making decisions, changes in how you think about yourself or your baby, have trouble bonding with your baby, thinking about hurting yourself or your baby, or thoughts of suicide. If you think you have signs or symptoms of postpartum depression, call your healthcare provider right away. There are things you and your provider can do to help you feel better. If you are worried about hurting yourself or your baby, call 911. Some discomforts after giving birth are normal, but new moms may be at risk of serious health conditions that need medical care. Learning signs and symptoms of health complications may help save your life. Getting treatment quickly may help prevent certain life-threatening conditions. Life-threatening conditions that can happen after giving birth include infections, blood clots, postpartum depression, postpartum hemorrhage. Warning signs to watch out for include chest pain, trouble breathing, heavy bleeding, severe headache, and extreme pain. If you think your life is in danger, call 911 or go to a hospital or emergency room. How does your body change in the weeks after giving birth? Many things are happening to your body after you have a baby. During pregnancy, your body changed a lot. It worked hard to keep your baby safe and healthy. Now that your baby is here, your body is changing again. Some of these changes are physical, like your breast getting full of milk. Others are emotional, like feeling extra stress. Many discomforts and body changes after giving birth are normal, but sometimes there are signs or symptoms of a health problem that need treatment. Go to all of your postpartum checkups, even if you feel fine. These are medical checkups you get after having a baby to make sure you're recovering well from labor and delivery. At your checkups, your healthcare provider can help spot and treat health conditions. Postpartum care is important because new moms are at risk of serious and sometimes life-threatening health complications in the days and weeks after giving birth. What is perineum soreness? The perineum is the area between your vagina and rectum. It stretches and may tear during labor or birth. If you're sore after giving birth, and it may be more sore if you have an episiotomy, please let us know. We can help with medications. The episiotomy is a cut that is made into the opening of the vagina to help let your baby out. Once again, these are not common, but sometimes they do occur in the event that the baby needs to be delivered rapidly. What you can do. Kegel exercises. These exercises strengthen the muscles in the pelvic area. To do Kegel exercises, squeeze the muscles that you use to stop yourself from passing urine. Hold the muscles tight for 10 seconds and then release. Try to do this at least 10 times in a row, 3 times a day. Put a cold pack on your perineum. This is ice wrapped in a towel. Or you can buy cold packs that you can freeze in your freezer at home. Soak in a warm bath. Wipe from front to back after going to the bathroom. This can help prevent infection as your episiotomy or laceration heals. Ask your provider about pain medication. Typically, pain medications include Tylenol and ibuprofen that can all be bought over the counter. What are birth pain? After birth pains are belly cramps as you feel your uterus shrink back to its regular size before pregnancy. The cramps go away in a few days. Right after you give birth, your uterus is round and hard and weighs about 2.5 pounds. By about 6 weeks after birth, it only weighs 2 ounces. What you can do to help with these pains. Ask your provider about over-the-counter medication you can take for pain. Over-the-counter medicine is medicine you can buy without a prescription. What body changes can happen after a C-section? A C-section is a major surgery, so it may take a while for you to recover. You may be really tired for the first few days or weeks after a C-section because you lost blood during the surgery. This is common in both C-sections and vaginal deliveries and is expected and anticipated. The incision on your belly may be sore. What you can do. Ask your provider for pain medication. Check with him or her before you take any medicine for pain. Ask your partner, family, and friends to help you with the baby and around the house. Get rest while you can. Sleep when your baby sleeps, even when he naps during the day. Don't lift from a squatting position. Don't lift anything heavier than your baby. Support your belly with pillows when you're breastfeeding. Drink plenty of water to help replace fluids in your body. What is vaginal discharge? After your baby is born, your body gets rid of the old blood and tissue that was inside your uterus. This is called vaginal discharge or lochia. For the first few days, it's heavy, bright red, and may contain small blood clots. Over time, the flow gets less and lighter in color. You may have a discharge for a few weeks or even a few months or more. What you can do. Use sanitary pads until the discharge stops. What is breast engorgement? When your breasts swell as they fill with milk, It usually happens a few days after giving birth. Your breasts may feel tender and sore. The discomfort usually goes away once you start breastfeeding regularly. If you're not breastfeeding, it may last until your breasts stop making milk, usually within a few days. What can you do? Breastfeed your baby. Try not to miss a feeding or go a long time between feedings. Don't skip night feedings. Before you breastfeed your baby, express a small amount of milk from your breast with a breast pump or by hand. Take a warm shower or lay warm towels on your breast to help your milk flow. If your engorgement is really painful, put cold packs on your breast. If your breasts are leaking between feedings, wear nursing pads in your bra so your clothes don't get wet. Tell your provider if your breasts stay swollen and are painful. If you're not planning to breastfeed, wear a firm, supported bra like a sports bra. What is nipple pain? If you're breastfeeding, you may have nipple pain during the first few days if your nipples may crack. What you can do? Talk to your provider or a lactation consultant to be sure your baby is latching on your breast right away. The lactation consultants are available in the hospital, and there is one available in the Women's Healthcare Clinic with Vista. A lactation consultant is a person trained to help women breastfeed. Even women who have had breastfeeding problems in the past may be successful breastfeeding this time, and not everyone needs this consultation, but please ask to see if it's something that would benefit you to help you continue breastfeeding. Latching on is when your baby's mouth is securely attached or placed around your nipple. Ask your provider about cream to put on your nipples if they are sore or cracked. After breastfeeding, massage some breast milk onto your nipples. Let your breast air dry. What is swelling? Some women have swelling in their hands, feet, and face during pregnancy. It's caused by extra body fluids, and it may take time for the swelling to go away after you have your baby. What you can do: lie on your left side when resting or sleeping. Put your feet up. Try to stay cool and wear clothes that are loose and comfortable, and drink plenty of water. Hemorrhoids. What are hemorrhoids? Hemorrhoids are painful swollen veins in and around the anus that may hurt or bleed. Hemorrhoids are common during and after pregnancy. What you can do: soak in a warm bath. Ask your doctor about using an over-the-counter spray or cream for pain. Eat foods that are high in fiber, such as fruits, vegetables, and whole grain breads and cereals. Drink lots of water. Try not to strain when you're using the bathroom to have a bowel movement. What is constipation? Constipation is when you don't have bowel movements. You don't have them often, or your stools are hard to pass. You also have painful gas. This may happen for a few days after you give birth. What you can do: eat foods that are high in fiber, drink lots of water, ask your provider about medicine that you can take. What urinary problems can happen after giving birth? In the first few days after giving birth, you may feel pain or burning when you urinate, or you may have to urinate but find that you can't. Sometimes you may not be able to stop urinating. This is called incontinence. It usually goes away as your pelvic muscles become stronger after the baby is born. What you can do for pain, burning, or if you have trouble urinating: drink lots of water, run water in the sink when you go to the bathroom, soak in a warm bath. If the pain continues, tell your provider. What you can do for incontinence: do Kegel exercises to strengthen your pelvic muscles. Why do you sweat a lot after giving birth? This happens often to new moms, especially at night. It's caused by all the changing hormones in your body after pregnancy. What can you do? Sleep on a towel to keep your sheets and pillow dry. Don't use too many blankets or wear warm clothes to bed. Why do you feel tired after giving birth? You may have lost blood during birth, and this is common and anticipated, so it is not an emergency. This can make your body tired, and your baby probably doesn't let you sleep all night. What can you do? Sleep when your baby sleeps, even during naps during the day. Eat healthy foods like fruits, vegetables, whole grain breads and pastas, and lean meat and chicken. Limit sweets and foods with a lot of fat. Ask your partner, family, and friends for help with the baby and around the house. Limit visitors. You'll have plenty of time for family and friends to meet your new baby when you're feeling rested. When can you lose weight after giving birth? You lose about 10 pounds right away after giving birth, and a little more within the first week. This is a great time to get to a healthy weight, no matter how much you weighed before you got pregnant. Eating healthy and being active every day helps boost your energy level and can make you feel better. If you're at a healthy weight, you're less likely to have health conditions like diabetes and high blood pressure than if you're over or underweight. And just in case you get pregnant again, or if you're planning to have another baby sometime in the future, it's best to be at a healthy weight before your next pregnancy. What can you do? Talk to your provider about your weight. If you are overweight before pregnancy, you may want to lose more weight than you gained during pregnancy. Eat healthy foods. Limit sweets and foods with a lot of fat. Drink lots of water. Ask your provider about being active, especially if you've had a C-section. Begin slowly and increase your activity over time. Walking and swimming are great activities for new moms. Do something active every day. Breastfeed your baby. Breastfeeding helps you burn calories. This can help you lose the weight you gained during pregnancy faster than if you weren't breastfeeding. Don't try to lose too much weight too fast. Your body needs nutrients from food to heal. If you're breastfeeding, losing weight too fast can reduce your milk supply. Don't feel badly if you don't lose the weight as quickly as you'd like. It takes time for your body and your belly to get back into shape. Staying fit over time is more important than getting in shape right away after giving birth. What skin changes can happen after giving birth? You may have stretch marks on your belly where your skin stretched during pregnancy. Some women also get them on their thighs, hips, and bottom. They may not disappear after giving birth, but they do fade over time. What can you do? Use creams or lotions on your skin. They don't make stretch marks go away, but they can help reduce itching that comes with stretch marks. What hair changes can happen after giving birth? Your hair may have seemed thicker and fuller during pregnancy. This is because high hormone levels in your body made you lose less hair during pregnancy. After your baby is born, your hair may thin out. You may even lose hair. Hair loss usually stops within 6 months after you give birth. Your hair should regain its normal fullness within a year. What can you do? Eat lots of fruits and vegetables. The nutrients in fruits and veggies may help protect your hair and help it grow. Be gentle with your hair. Don't wear tight ponytails, braids, or rollers. These can pull and stress your hair. Use the cool setting on your hairdryer. When do you get your period again after you've had your baby? If you're not breastfeeding, your period may start again 6 to 8 weeks after giving birth. If you are breastfeeding, it may not start again for several months. Some women don't have a period again until they stop breastfeeding. When your period returns, it may not be the same as before you were pregnant. It may be shorter or longer than it was. Over a time, it often returns to the way it was before you got pregnant. What happens at a postpartum checkup? At your postpartum checkup, your provider makes sure you're recovering well after giving birth and adjusting to life as a mom. Here's what to expect. Physical exam. Your provider checks your blood pressure, weight, breast, and belly. If you had a C-section, your provider may want to see you about 1 week after you give birth so they can inspect the incision. A C-section is surgery in which your baby is born through a cut that your doctor makes in your belly. Most C-section incisions heal without any problems, but they can get infected. You get a pelvic exam. Your provider checks your vagina or birth canal, uterus, and cervix. The cervix is the opening to the uterus that sits at the top of the vagina. If you had an episiotomy or a tear during birth, your provider checks to see that it's healed. Your provider can tell you when it's safe to have sex again, which is typically 6 weeks after delivery. Your provider checks any health conditions like diabetes and high blood pressure you had during pregnancy. For example, if you had gestational diabetes, your provider may give you a blood glucose test to check your blood sugar. Gestational diabetes is a kind of diabetes that some women get during pregnancy. If you're breastfeeding, ask your provider to make sure any medicine you take is safe for your baby. You may need to stop taking a medicine or switch to one that's safe for breastfeeding. Don't stop taking any medication without talking to your provider first. Your provider makes sure your vaccinations are up to date, including vaccinations for flu and pertussis, which is also whooping cough. By getting vaccinated, you can help keep from getting sick and passing any illnesses to your baby. Birth control. If you didn't talk about birth control with your provider before you had your baby, talk about it at your postpartum visit. Talk to your provider about birth control options and how they fit with your plans about having more children. Ask about using an IUD or an implant, which are long-term but reversible contraceptive options that keep you from getting pregnant again too soon.